12 warning signs of blood clots. Imagine this. Inside your body, a danger lurks silently, one that could strike unexpectedly and lead to devastating consequences, such as heart attacks, strokes, or even sudden death. We're talking about blood clots. A serious medical condition that doesn't always scream for attention until it's potentially too late. Think about it. Would you know the warning signs if a blood clot was forming in your body right now? Most people wouldn't, and that's exactly why we need to talk about this. Recognizing these signs early isn't just important, it could be the difference between life and death. In today's video, we'll uncover the crucial symptoms of blood clots. Are too dangerous to ignore. Stay with us to learn how you can protect yourself and your loved ones by catching these warning signs early. Let's get started. Number 1, swelling. One common yet often overlooked sign of a blood clot is unusual swelling, which might occur in one or both legs or sometimes in the arms. Imagine you haven't bumped into anything, nor have you injured yourself, but you notice that your leg or arm starts to swell. This could be a silent alert from your body pointing towards a blood clot. When a clot forms in a vein, especially in the deep veins of your legs, it can block the flow of blood returning to the heart. This is similar to what happens in a traffic jam. When cars block the road, no one can move forward and everything backs up. Similarly, when a clot blocks a vein, blood can't circulate properly, leading to fluid buildup in the affected area, causing it to swell. It's essential not to dismiss this swelling, as it's not just an inconvenience. It could be a harbinger of more severe complications. For instance, part of the clot could break off and travel to the lungs, leading to a pulmonary embolism, which is life-threatening and requires immediate medical attention. If you observe this kind of swelling, especially if it's accompanied by pain and redness, it's crucial to seek medical advice promptly to ensure early intervention and prevent potentially severe outcomes. Remember, catching and treating a blood clot early can save your life, so keep an eye out for these critical signs. If you notice any form of swelling, comment swelling. And please do not ignore this critical sign. Seek medical advice. Number 2, pain or tenderness. Pain or tenderness in the legs, particularly in areas like the calf or thigh, can be a red flag for blood clots. This isn't the typical muscle soreness that comes after a workout or from overexertion. Rather, it's a persistent, often unexplained pain that doesn't seem to align with your recent physical activities. Imagine how it might feel if the blood flow in your leg was suddenly squeezed by an invisible force. This is similar to what happens when a clot forms. The clot acts like a roadblock, preventing blood from circulating normally, which increases the pressure in the vein. This buildup of pressure can cause pain or tenderness in the area, making even simple activities uncomfortable or painful. It's crucial to differentiate this type of pain from ordinary aches, because ignoring it could lead to severe complications. Medical experts stress the importance of recognizing this symptom and seeking immediate medical attention if you experience such pain. The reason for urgency is that a clot can become more dangerous if it moves to the lungs or other vital organs. If you notice pain in your leg that doesn't make sense based on your recent activities, and especially if the area also feels warm or looks red, it's important to consult a healthcare provider to rule out the presence of a blood clot. Early detection and treatment are key to managing the risks associated with blood clots effectively. If you notice any form of redness or discoloration, comment redness and discoloration, and please seek medical advice as soon as possible. Early intervention is key to effectively managing the situation and ensuring your safety. Number 4, warmth in one area. Have you ever felt an unusual warmth in a specific spot on your body without any apparent external reason, such as being in the sun or applying a heat patch? This could be more than just a random occurrence. It might be a sign of a blood clot. When a clot forms in a vein, it can cause inflammation, which in turn increases the temperature of that area. This warmth is localized. It doesn't spread across a large area of your body, but is confined to where the clot is disrupting blood flow. The reason behind this warmth is the body's response to what it perceives as an injury. The clotting process is essentially part of the body's way of stopping bleeding, but when a clot forms inside a vein without a bleeding injury, it can lead to problems. The inflammation caused by the clot increases blood flow to that region as part of the immune response, intended to heal what the body mistakes as tissue damage. This increased blood flow raises the temperature, resulting in warmth that you can feel on the skin over the clot. If you notice this kind of localized warmth, especially if it comes with swelling, redness or pain, it's important to take it seriously. These symptoms together can indicate a significant issue, such as deep vein thrombosis. Do not overlook these signs. Consulting with a healthcare provider can help determine the cause and prevent more severe complications, such as a pulmonary embolism, a critical condition. If you notice any warmth in one area, comment warmth. Remember, recognizing and addressing these symptoms promptly could be crucial for your health. Number 5, cramping. Cramping that occurs without an obvious trigger, like intense exercise or dehydration, can be particularly concerning. These aren't your typical muscle cramps that might come after a long run or on a hot day when you haven't drunk enough water. Instead, the cramps associated with blood clots can feel similar but have a very different underlying cause. This type of cramping can persist and may not ease up with the usual remedies, like stretching or hydrating, that typically help resolve ordinary cramps. When a blood clot forms in a vein, especially within the deep veins of your legs, it can restrict blood flow, leading to pain and cramping in the affected area. The cramp feels deep, often described as a sharp muscle contraction or a persistent throbbing that doesn't go away with changing positions or through massage. This occurs because the clot continues to block blood flow, maintaining pressure in the vein that manifests as cramping. It's important not to dismiss these signs as minor muscle issues, especially if they persist or are accompanied by other symptoms like swelling, redness, or warmth in the area. Such cramps are a red flag and warrant immediate medical attention. Ignoring these symptoms could lead to severe complications if the clot dislodges and travels to vital organs, such as the lungs, which can be life-threatening. If you notice any form of cramps, comment cramps, and please always err on the side of caution and consult with a healthcare professional if you experience unexplained persistent cramping. Early diagnosis and treatment can be life-saving. Number 6, shortness of breath. Experiencing shortness of breath is common after physical exertion or due to underlying health issues like asthma. However, if you find yourself gasping for air unexpectedly while at rest, it's a different concern altogether. This type of breathlessness, sudden and unprovoked, can be alarming. It's important not to confuse or dismiss this symptom as a minor issue, because it may be a sign of something much more serious, such as a pulmonary embolism, a condition where a blood clot blocks one or more arteries in your lungs. When a clot travels to the lungs and causes a blockage, it disrupts normal blood flow and oxygen exchange. As the lungs struggle to provide oxygen to your blood and your heart works harder to pump blood through the obstructed lungs, you feel short of breath. This is not just a simple lack of air. It's a critical signal that your body isn't oxygenating properly. The sensation might be accompanied by chest pain, dizziness, or a rapid heart rate, intensifying the urgency of the situation. Recognizing sudden shortness of breath as a potential red flag for a pulmonary embolism is crucial. If you experience this symptom, especially if it's paired with other signs like leg pain or swelling, immediate medical evaluation is essential. Early detection and treatment can dramatically reduce the risk of severe complications or even death. If you observe any shortness of breath, comment shortness of breath. If you find yourself unexpectedly struggling to breathe, seek medical help right away. It's always better to be safe and have it checked out. Number 7, chest pain. Chest pain can be one of the most alarming symptoms of a blood clot, especially if it feels sharp, pressing, or comes on suddenly without an obvious reason. This type of chest pain, often linked to a pulmonary embolism, PEE, can feel intense, sometimes mimicking the symptoms of a heart attack. It may feel like a deep stabbing sensation in your chest or like pressure that makes breathing painful and challenging. Unlike typical muscular chest pain, which might ease with rest or changing positions, PE chest pain persists and can even intensify when you breathe deeply or move. When a clot reaches the lungs and obstructs blood flow, it strains the heart and lungs as they work harder to supply oxygen to your body. This creates a painful sensation that is difficult to ignore. The similarity to heart attack symptoms can make it hard to distinguish, which is why any chest pain, especially if accompanied by shortness of breath, rapid heartbeat or dizziness, should be treated as a medical emergency. If chest pain appears alongside other signs of blood clots, such as leg swelling, warmth or redness, it's essential to seek immediate medical help. Acting quickly is crucial because a pulmonary embolism can be life-threatening. If you notice chest pains, comment chest pains. Remember, it's always better to err on the side of caution and get checked out. Seeking timely intervention could save your life, especially when these symptoms are recognised and addressed without delay. Number 8. Rapid heartbeat, tachycardia. Experiencing a rapid heartbeat or tachycardia can be startling. It's your heart's way of telling you that something isn't quite right. When a blood clot impairs circulation, your heart may beat faster as it tries to compensate for the reduced blood flow. It's working harder to pump blood through blocked vessels, attempting to maintain adequate circulation and oxygen delivery to your tissues and organs. It's important to differentiate this type of rapid heartbeat from those caused by less concerning factors like caffeine consumption, stress or exercise. While these causes are generally harmless and temporary, a rapid heartbeat due to a blood clot can be a sign of a serious problem, especially if it occurs suddenly and is accompanied by other symptoms like shortness of breath, chest pain or dizziness. You should never ignore a rapid heartbeat when it occurs alongside these other warning signs. This combination could indicate a potentially life-threatening condition such as a pulmonary embolism, where a clot has travelled to the lungs, or deep vein thrombosis, where it remains in the deeper veins of the legs. In these scenarios, the fast heart rate isn't just a symptom, it's a cry for help from your body, urging immediate medical attention. If you notice any form of rapid heartbeat, comment rapid heartbeat and please do not ignore this critical sign. Seek medical advice. Recognizing these signs early and acting on them can make a significant difference in outcomes. Always err on the side of caution and seek professional medical advice if you experience a rapid heartbeat, along with other signs of a blood clot. Number 9, coughing up blood. Coughing up blood, medically known as hemoptysis, is a severe and alarming symptom that can indicate significant issues within the lungs, including complications from a blood clot. When blood appears in your cough, it's not just a symptom to be wary of. It's an urgent sign that your lungs may be suffering from damage or distress. This can occur when a clot lodged in the pulmonary arteries impedes blood flow and increases pressure in the delicate capillaries within the lung tissue, causing them to rupture and bleed. The sight of blood in your sputum is undeniably distressing, and understanding its severity is crucial. While it might be startling, it's important to remain calm and act swiftly. Hemoptysis due to a pulmonary embolism is particularly serious because it indicates that the clot is affecting the lungs' ability to oxygenate blood and maintain proper circulation. This isn't just a cough, it's a potential medical emergency where every second counts. If you or someone else experiences coughing up blood, especially if it's accompanied by sharp chest pain, shortness of breath, or a rapid heartbeat, immediate emergency help is required. Don't wait or attempt to self-diagnose. Seek professional medical attention right away. This symptom is a critical warning sign that needs prompt evaluation and treatment to prevent more severe consequences. If you ever start coughing up blood, comment coughing up blood, seek medical advice. Recognizing this symptom and understanding its urgency could very well be life-saving. Number 10, dizziness or lightheadedness. Dizziness or lightheadedness is often dismissed as a minor nuisance, perhaps caused by standing up too quickly or not eating enough. However, when this symptom results from compromised blood flow due to a blood clot, its significance increases dramatically. This type of dizziness occurs because a clot can restrict blood flow, reducing the oxygen supply to the brain, which is crucial for maintaining equilibrium. When your brain doesn't receive enough oxygen, it can lead to feelings of instability, disorientation, or even fainting spells. If you experience dizziness alongside other warning signs of a blood clot, it's crucial to seek immediate medical attention. Dismissing this as just another dizzy spell could delay essential treatment and potentially lead to severe complications. If you notice dizziness or lightheadedness, comment dizziness or lightheadedness. Always err on the side of caution. Recognizing and responding to these signs promptly can be essential for preventing serious outcomes and safeguarding your health. Number 11, severe headache. Severe headaches can sometimes be a regular discomfort we all experience now and then. However, if a headache is sudden and intensely painful, it might be a sign of something much more serious, such as a blood clot in the brain, known medically as cerebral venous sinus thrombosis, CVST. This condition occurs when a clot forms in the brain's venous sinuses, preventing blood from draining out of the brain. As blood backs up, it can lead to increased pressure within the skull, manifesting as a severe headache. The headache caused by CVST is typically very severe and may feel different from any other kind of headache you've experienced. It can be accompanied by other alarming symptoms such as vision problems, nausea, vomiting, dizziness or seizures, all of which indicate the potential for stroke or brain swelling, requiring immediate medical intervention. It's crucial to differentiate between a common headache and one that could signify a blood clot. A headache linked to CVST or other clot conditions isn't likely to be relieved by over-the-counter pain medication and shouldn't be ignored or self-managed. If you or someone else experiences a sudden, severe headache, especially with other symptoms of a clot, it's vital to seek emergency medical help right away. If you start to notice severe headaches, comment severe headaches. Recognizing these signs and acting quickly isn't just cautious, it could save a life, preventing severe complications or irreversible damage. Number 12, sudden vision changes. Sudden changes in vision can be unsettling and often signal that something serious is happening with your health. In some cases, these changes can be caused by blood clots that block blood flow to crucial parts of the eyes. When a clot disrupts normal circulation, the cells in the retina or other parts of the eye may begin to suffer from a lack of oxygen. This can manifest as blurred vision, partial or complete vision loss, or seeing dark or floating spots. The stakes are high with these symptoms because without prompt and effective treatment, vision loss could become permanent. The blockage caused by the clot prevents vital nutrients and oxygen from nourishing the eye, and without these, the delicate tissues of the eye can sustain lasting damage very quickly. If you experience a sudden unexplained change in your vision, such as blurriness, blind spots, or total loss of sight in one eye, it's crucial not to dismiss it as something minor like eye strain or fatigue. This is a situation where immediate medical evaluation is necessary. Seeking urgent care dramatically increases your chances of a full recovery and reduces the risk of permanent damage. If you observe sudden vision changes or blurry vision, comment vision changes. Always treat sudden vision changes as a potential medical emergency. Acting quickly can make all the difference in preserving your sight. Prevention tips for blood clots. Maintaining good health and preventing blood clots starts with a few key lifestyle changes. 1. Stay active. Regular movement boosts circulation and prevents blood from pooling, reducing the risk of clot formation. Whether it's a brisk walk, a bike ride, or any physical activity that gets your heart pumping, staying active is your first line of defense. 2. Hydrate well. Drinking enough water keeps your blood thinner, making clots less likely to form. Dehydration can cause blood to thicken, increasing the risk of clotting. 3. Avoid prolonged sitting. If you're sitting for long periods, whether at a desk or on a long flight, make a habit of standing up and stretching your legs regularly. Flexing your calves and taking short walks can stimulate circulation and lower clot risk. 4. Use compression stockings. For those at higher risk, compression stockings help improve blood flow, reduce swelling, and prevent clot formation in the legs. 5. Manage chronic conditions. Diabetes, high blood pressure, heart disease, and obesity can increase your risk of blood clots. Keeping these conditions under control through medication, exercise, and a healthy diet is crucial. 6. Eat a heart-healthy diet. Foods rich in omega-3 fatty acids like salmon, walnuts, and flax seeds, and antioxidants support vascular health and reduce clotting risks. Maintaining a balanced diet lowers inflammation and promotes proper blood circulation. By combining these habits, you can take a proactive approach to reducing the risk of blood clots and promoting long-term vascular health. Risk factors for blood clots. Understanding the risk factors for blood clots is essential for prevention and early detection. Some key factors include 1. Prolonged inactivity. Extended periods of immobility, such as bed rest after surgery, long flights, or sitting for hours can slow blood flow and increase clot risk. 2. Injuries and surgeries, major surgeries or injuries, particularly those involving the legs, can contribute to clot formation due to reduced movement and healing responses. 3. Lifestyle factors, smoking, obesity and pregnancy can all elevate clot risk by affecting circulation and blood composition. 4. Medical conditions, diseases like atrial fibrillation, cancer, and inherited clotting disorders significantly increase clotting risks. 5. Age and genetics. Older adults and those with a family history of blood clots are at a higher risk. 6. Proactive management through lifestyle adjustments and medical guidance can greatly reduce your chances of developing a serious clot. What to do if you suspect a blood clot? If you suspect a blood clot, acting with caution and urgency is crucial. Do not massage or press on the affected area, as this could cause the clot to dislodge and travel to vital organs. Seek emergency help immediately if you experience chest pain, shortness of breath, or sudden dizziness. These could be signs of a life-threatening pulmonary embolism. Medical diagnosis may involve 1. Ultrasound to check blood flow and identify clot presence. 2. DD dimer blood test detects clot substances in the blood. 3. Imaging scans, CT, MRI or venography, helps visualize clot location and severity. Timely medical evaluation can prevent complications and ensure appropriate treatment. Treatment options. Treatment depends on the severity and location of the clot. Anticoagulants, blood thinners, these prevent existing clots from growing and reduce new clot formation, but do not dissolve clots already present. Thrombolytics, powerful clot-dissolving drugs used in severe or life-threatening cases such as PE or stroke. Due to their bleeding risks, they are used with caution. Surgical removal. In cases where medications are ineffective or a clot is too large, doctors may physically remove the clot. After treatment, following your doctor's recommendations, including taking prescribed medication and adopting a healthy lifestyle, reduces the risk of future clots. Myths and misconceptions about blood clots. There are many misconceptions about blood clots that can lead to underestimating risks. Myth: Only older adults get blood clots. Fact: blood clots can affect anyone regardless of age, especially due to immobility, medications or surgery. Myth: all leg cramps are harmless. Fact: persistent leg pain with swelling or warmth could indicate a deep vein thrombosis, DVT, requiring immediate medical evaluation. Staying informed and understanding the true warning signs ensures that individuals seek timely medical care when necessary. We truly appreciate your time and attention in learning about the warning signs, risks, and prevention of blood clots. Staying informed is one of the most powerful ways to protect yourself and your loved ones from serious health complications. Knowledge saves lives, and by understanding these symptoms, you are taking an important step toward prioritizing your well-being. If you found this information helpful, please consider sharing it with friends and family. It could make all the difference for someone in need. Stay safe, stay healthy, and stay informed. Don't forget to like, subscribe, and turn on notifications so you never miss important health updates. We'll see you next time with more valuable health insights. Take care and thank you for watching.